Hi, I'm Ginger Garner. Today we are going to be working on triangle pose. It may be a nemesis pose for a lot of people, and it's certainly a common pose that I see people increasing their risk for injury unnecessarily. So today I want to show you how I scaffold, or how I do a micro sequence of triangle to get people in and out of that pose safely and effectively from a therapeutic standpoint. What we need to be aware of is that there's a finite range of motion in the hip. And for some people, they may have impingement in the hip that may be true or false. But whether or not it is real or a false impingement, we still have to treat it the same until you can get to your physical therapist to evaluate it fully and see what's going on. So that means protecting the hip and triangle, but also making it more effective for the muscle groups around it. So we'll focus on this area of the pelvis here, because the way we align the hip may actually create impingement or injury or prevent it. And I'd like for you to align triangle in this way in order to be able to prevent premature impingement or to exacerbate any impingement that's there, or just to preserve the hip in general. This is also more protective for the spine and builds more core stability. And it also helps the shoulder. Find your mountain. Ground through the front side of your heel. Lift the toes, separate them, breathe under the arches. Feel yourself become taller. I'm going to come down through chair. Okay, chair, you can do chair with the knees past the toes, doesn't matter, but it's too easy, okay? It's too easy. So instead of being here for chair, I'd like for you to be here. Pull the knees back so that you can see the toes, almost as if your knee joint was going to be over the outside of your ankle. Be aware that you're not flattening or guarding, or you're not swaying. Bring it happily halfway in between. You're going to take a short warrior one lunge. This is not a big lunge to be in. Okay, that increases hip impingement risk. Then you're going to lift the back heel, turn it back, and set it down. Now, what does that do? That perfectly aligns your feet so that your front arch, your front heel bisects your back arch. That's important for the finer alignment of the hip joint. If the back foot is too far back or too far forward, you're more likely to impinge. So front heel, if a line is drawn, bisects the back arch. This puts you in what's called a triplanar position. So if I had my pelvis here, you would see that it's not angled towards you. It's angled off in kind of the 2 o'clock direction or the 11 o'clock direction, whatever your perspective is. That means you're not between two panes of glass, because that would create a firm end range and a lot of stress on the capsule and the labrum, and that's not what we want in the hip. So you're off in this triplanar range. Next, I want you to bend the front knee. If you have ever had any pinching in the groin, I want you to bend both knees. And that's where you're going to do your triangle. A lot of people have problems with guarding this set of muscles here in the hip flexors and the glutes. So I want you to bend your knee, because it helps you learn how to bend at the hip joint instead of treating triangle like what I call an injury trifecta, which is side bending, flexion, rotation. That's not a great place for the spine to be, especially when we're trying to build a lot of core strength and stability. Bend your front knee, that's the first part of the scaffold. Then see how the pelvis can just tilt here? That leaves my spine alone. I'm not actually doing anything in my spine. All I'm doing is the steering wheel of the pelvis is turning, and the easy way to do that is by bending the knee. Let's say my triangle looked like this. I'm going to need that slight chin nod, the chin lock, right? Just a very slight nod. If I bring my arm down to my leg, I need an arm spiral. So the elbow spirals out, faces out this way, and the palm rolls down. The shoulder comes away from the ear. This prevents us from doing this, lifting with the upper traps, which is also not sustainable. If you decide to lift the top arm, do an arm spiral here also. Elbow faces out, palm faces forward, shoulder away from the ear. And you'll notice that I'm kind of like a tin soldier. I don't have to do anything with the spine, which is a safe position. Once you master bending at the hip, you can go down a little further. What you want to avoid doing is putting the pelvis between two panes of glass. That's not sustainable. It's not physiologically possible either. You also want to avoid letting the whole pelvis dip and dump forward, because that puts a lot of strain on what's called the Y ligament in the hip. If you create laxity in that, then the hip can become unstable. So how do we avoid that? By using the hip lock. That means this leg stays in a nice neutral position. Like I said, if you have pinching in the groin, bend the knees, right? As you turn the steering wheel of the pelvis under, the hip does not jut forward. This outer part of the hip stays in line with the outer ankle. You can move your way down into the pose, really focusing on lengthening of this area here. I'm working on trunk stability. The spine is nice and safe. I take my arm spiral, so elbow up, palms down. If I want to turn up and look, chin lock, and then I look up. And then to come up, let your arm pull you up, but also feel that you are firming up the abs using your abdominal lock. Now, I've mentioned several locks. If you haven't watched the locks video yet, that would be a great help. So you may want to watch the locks video and then do triangle. Let's switch the feet around and go to the other side. So left foot turning out. The right foot can be straight ahead or slightly in. The pelvis is in a triplanar position. You can bend the front knee to get that steering wheel of the pelvis tilting, so it all comes out of the hip joint. If you have any groin pain, bend both knees. Okay? Once you get the pelvis to steer itself left, you'll realize you don't really have to do a lot with the spine. Then you can set the arm down wherever it can feel supported with an arm spiral, shoulder away from the ear, arm spiral, shoulder away from the ear, chin lock, and then look up. Make sure that this hip stays back, that it does not come forward, so that you're protecting the cartilage and the ligament in the hip. Lift the toes, breathe under the arches. To come up, you may want to bring your hand down and feel the abdominals supporting you as you come up. That's called a TATD breath. Okay. So 2 videos I'd recommend that you watch to really master this pose are your locks video. The nap meditation is also helpful, and the TATD breath video. All right, thanks for joining me. That's how I align triangle pose in a way that's safe for anyone who has spine issues, back pain, any hip or pelvic pain or hip impingement issues at all. It makes it safe for any population and also more effective. Thanks.